Hello, timber friends. Okay, I'm here this morning and cleaning out your suction lines, your vacuum lines in your mechanical room. And one of the things I noticed is that your solids container or your amalgam separator is a couple years past due. So what we want to have happen in the future is that one person's accountable for going in there, turning off the vacuum once a month, watching the water level decrease so that you can see clearly the level of sediment in the bottom of that lower cartridge. When you start to see that get close to the fill line, you're going to want to make sure that you order a replacement cartridge, and then when that comes in, go ahead and switch it out. So for you guys, that's probably going to be every 2 months. You're going to probably be close to that fill line. Most important for your vacuum line maintenance and clearing the lines and making sure that your suction is at its optimum level, as well as your vacuum being maintained well, is to clean your vacuum lines daily. So cleaning your vacuum lines daily is not a should, it's actually a must. And that means that each operatory is you use that doggy dish or the aspirated solution through both the saliva ejector and the HVE. And our service technicians will tell you that what they want you to do is to start in the operatory that's furthest away from the mechanical room. So for you at Northeast, that's going to be closest to your patient area. So start in that operatory first and open up those lines, the vacuum, all your saliva ejector and HVEs, clean those lines, leave them open when you go to the next operatory. So you'll hear that section, and what that allows to happen is it's a long distance for tubing from that first operatory all the way back to the mechanical room. And what we want to make happen is when those valves are left open, we can ensure that we're getting all of the proper enzymatic solution and any debris all the way from that operatory back through the vacuum. So just move from operatory to operatory, leaving the previous operatory's valves open until you get to the last operatory, and then you can leave that one on and shut it off. So sometimes we think, when are we going to have time to do this? We're open till 7, we're not leaving here till 8 p.m. You don't have to do this at the end of the day. You could do it right before lunch hour, or you just want to make sure that you work through it at some point in the day, once a day. And then the obvious other times would be if you're doing a pretty bloody or mucky kind of surgery, run the vacuum lines right after that to clean the lines to make sure that those organic enzymes are broken down right at the get-go. All right?
And then how often should we change our little plastic traps in each operatory?
Good question. So this we call those the solids traps in your operatory. Check those weekly. If there's debris in there and it looks like you can just easily shake it out and it's not alloy, go ahead and shake that in the trash and replace it. If it's gooky or it has any amalgam in it, the amalgam, you're required to dispose the whole disposable trap into an amalgam receptacle.
And then is there something called shocking the lines that needs to happen? Is that something, I don't know exactly what that means, but someone had asked about shocking the lines.
Sure, good question. That's not related to your vacuum. That would have to do with your water lines, and we can do that on a separate. So shocking your lines would not have anything to do with your vacuum lines. That's just going to be your regular cleanser and enzymatic cleaner through your vacuum lines. We can talk about shock, but that would be through your water lines, which is different.
Okay. Thank you so much, Sonya.
Thank you.